This is an Article 999 summary of the NICE guidelines relating to epilepsy. Epilepsy is a common neurological disorder characterized by recurring seizures. 2/3 of patients have their epilepsy controlled satisfactorily with anti-epileptic drugs or AEDs. When reading through this, remember to check your local guidelines and your JR calc before copying anything here, especially as these drugs may not be the ones we carry. First, give immediate emergency care and treatment to children, young people and adults who have prolonged or repeated convulsive seizures in the community. Treatment of tonic-clonic seizures. First, secure the airway, then give high concentration O2, assess cardiac and respiratory function, check the BM, and secure IV access in a large vein. Next, monitor regularly, consider the possibility of non-epileptic status, administer emergency AED therapy. For AED therapy, buccal midazolam is the first-line treatment. Rectal diazepam is given if preferred or if buccal midazolam is not available. Intravenous lorazepam is given if IV access is already established and resus facilities are available. For diazepam pre-hospitally, give 10 to 20 mg rectally, repeated once 15 minutes later. Administer a maximum of 2 doses of the first-line treatment. In patients with learning difficulties, care should be taken to obtain a full clinical history. If possible, have eyewitness accounts and evidence like videos. Witnesses may need education to describe their observations accurately. Pregnant women and girls should be reassured that there is no evidence that focal absence and myoclonic seizures affect the pregnancy or developing fetus adversely unless they fall and sustain an injury. Don't discriminate against any group and offer the same services, investigations and therapies as for the general population. All adults having a first seizure should be seen as soon as possible by a specialist. So should children and young people who have had a first non-febrile seizure. This could be used as worsening advice for patients who have their own midazolam and remain at home. Call 999 if the seizure continues for 5 minutes after the emergency medicine has been administered. Here's more worsening advice, this time for any patient with a history of seizures who remains at home. Call 999 if the patient has frequent episodes of serial seizures or has convulsive status epilepticus, or this is the first episode requiring emergency treatment, or there are concerns or difficulties monitoring the patient's airway, breathing, circulation, or other vital signs. Finally, here are some definitions that are going to go very quickly. Please feel free to pause them as needed. Head to article999.co.uk for more videos.